Hi, I'm Dr. Denis Jimenez with Holton Community Hospital General Surgery. Did my pre-med philosophy major at Cornell College in Iowa, and then medical school at University of Kansas in Kansas City.
Okay. So it was more kind of a sports-related thing that kind of triggered you to be more integrated into the medical field, and now that's kind of where you want to help people in those same situations. Is that accurate to say?
Yeah. So the interest in the science and the biology kind of started it. And especially in medical school, I spent a lot of time, probably more than any of my classmates, going to the free student-run health clinic that we had near the hospital. And I saw over 200-300 patients before I even got to my clinical rotations, which was great experience, but that's really started to connect with patients and people that, you know, when you're going to college or medical school, you aren't interacting with as often. And that's where you really feel God's presence among people and that enjoyment of serving people and helping them. And that's become a core part of my identity as a doctor since then.
Very cool. Your focus of why you're wanting to help people, you mentioned seeing kind of the beauty of it. And what triggers that for you?
It's just the love that comes through when you see people in times that they're struggling, when they're dealing with medical issues that affect many aspects of their life, and being able to make a difference in some way that could potentially help someone.
It's very cool. Working at Holton Community Hospital, can you tell me how long you've been working with the hospital?
I've been at Holton Community Hospital for a little bit over a year now, but during my surgery residency training, I actually started talking with them early on, really almost as soon as I hit the ground. I learned about the hospital and the community through my sister, Samantha Reshik, who's a local dentist, and talking with her, I was looking for a place to start a rural surgery practice, right? Ever since I decided to do general surgery, I knew I wanted to serve in a rural area because that's where my roots come from. And starting that conversation early in my surgery training, I was able to continue the conversation throughout that time period and really customize the subspecialty experience and just my focus on the needs of the community here, and really kind of tailor my surgical skills to what the community needs.
So you mentioned how you grew up in a rural town. You moved to a larger town in Wisconsin. What drew you to come back to rural?
I've got 4 sons, and I think that a rural community is the best place for them to grow up. I don't know what to tell you.
Yeah.
When you are a father, especially of boys, it's just feels like the right place to get out and run around, and the right kind of people for them to draw inspiration from as they grow into men.
I'm going to parlay onto that a little bit more with Holton specifically. You mentioned how in your early residency and stuff you were coming here. What drew you to Holton Community Hospital specifically?
So again, it was as I was looking for a rural community and just really talking to my sister about, her decision to go to a rural community when she kind of was in dental school. It just came up that, hey, the one of the surgeons around here is looking at retiring soon, and maybe talk with the hospital and talk with the board, and then that kind of got me hooked in here.
What challenges do you see in surgery? And then on the flip side of that, we'll follow it up with what rewards that you see while practicing surgery. So we'll start with the challenges first. What challenges do you face with surgery?
So aside from the obvious, medical and technical aspects of surgery, I think one of the most important things is putting all of the medical decision-making, surgical decision-making into the context of each individual patient. Everybody's got different priorities, different timelines, and you really need to take some time to understand someone to see how that decision-making is going to fit in. We're not at a point anymore in medicine in general where you're coming in and we're saying, I'm the doctor, this is what you're going to do. It's, hey, I'm here to help you and advise you. This is what's going on. Let me use my expertise so that you can understand what's going on, no matter what your level of education or understanding is. And so that we can try to make sure that we are doing the best we can for you to improve your quality of life as much as the science can allow.
So it's important for you to build a relationship with your patients as well.
Absolutely.
And what are some rewards that you've seen and that you've been a part of with general surgery?
I think the most rewarding thing, aside from, hey, this was hurting, we fixed it, it's gone, or hey, I had cancer, it's, taken out now, I'm, and my treatment's going well, is just the feedback that you get from patients that, hey, I really love the way you explained that to me. No one's talked to me like that before. Or the feedback you get from their primary care doctors that, hey, I'm really glad you sent me over there.
Mm-hmm. Can we dive deeper into the relationship side of it? If you don't mind, I'd like to know, why is it important for you to establish more than just a doctor-patient relationship with your patients?
Because people are more than just patients. They're more than just their diagnoses or ailments. And again, it just gets that all back into the context. What do you do? How is harvest? What kind of function do we need to get you back to after surgery? Mm-hmm. And how can we time that so that it's not going to interfere with things that you need to do?
That's good stuff. You're a military man. If you don't mind, tell me about what drew your decision to join the military and why it was important for you to serve in that way.
So I come from a military family. My grandparents' generation were all in the Army. My dad was in the Navy. I've got cousins that are Marines. So it was always in the back of my mind. My dad enlisted after high school and was a SEAL for a little while before he got out. And he always prioritized my education first. And so I didn't join the military until my first year of medical school. That's enough education at that point. So I direct commissioned into the Army National Guard at that time to do the dual service mission thing. And it'll be 10 years this Saturday.
And so your balance of being in the Guard as well as your surgical practice, what does that look like, having to balance that?
So it's always been more work. Going through medical school and having to do all of the medical school work, plus fit in my drill weekends and my annual training, and longer schools like the officers leadership course, and same with during surgery residency, which is already an average 80 hours a week job, and then throw in the travel for the drill for that. But it's always been value add. It's a community that I really enjoy serving. In my mind, as a doctor in the military, you're really just serving service members, and that's where I get a lot of the meaning from.
And the inspiration I think you referenced is family ties to the military. What was your defining moment where you decided, I'm going to do this as well?
I think, I'm not sure there was necessarily one defining moment. It was just always in the back of my mind, I'm going to do it some way, somehow. And I don't have any particular plans on getting out anytime soon.
Cool. We're talking about balance with different things. You got a great home life as well. You mentioned your 4 kids. Tell me a little bit about your family.
My wife Elizabeth and I have 4 sons. They age 12, 10, 8, and 4. They all go to Jackson Heights, and they're becoming increasingly involved in sports. We're doing wrestling right now. Soccer will be back up in the spring.
It's important for you to have that balance. Tell me the difficulty of the guard, your medical practice, and just being a husband and dad when the kids are starting to get more involved in everything. How difficult is it for you from that perspective?
It's always been a balancing act, and I couldn't do it without the support of my wife. I was already in the National Guard when I met her, so it's always been an understanding that was part of it, and we always knew that deployments were going to be part of it. And just maintaining this open communication and mutual support.
I like that. Community engagement, Jackson County as a whole, there's a lot of people in the rural aspects of it. Outside of the hospital, what do you do to stay involved in the community?
Probably the most frequent place that I interact with community members is down at Rhino Fitness. But I've done some of the walk with the docs. I've been known to sing every now and then at Soldier Christian Church with my sister and my wife recently this past weekend as well.
Oh, fun.
And recently I was asked to sit on the board for the Northeast Kansas Regional Trauma Council Executive Committee, just to kind of get a little bit more involved with trauma matters in this part of the state. So
we've had walk with a dog. It's time to have a sing with the dog. Is that what I'm understanding?
Yeah, we'll do karaoke in the atrium.
Okay, sounds good. Future of healthcare. Wanted to know where you see the future of healthcare, especially with surgery going, that may be different than what it looks like now.
So where I would like to see surgery and medicine go is a little bit more decentralization, and just there's kind of an overall trend of bigger hospital systems buying up smaller places in order to kind of funnel to one place, one area. And it really kind of limits access to care if you're not close to those large centers. 80+% of medical problems and surgical disease can be treated in smaller hospitals like this. And just logistically, it doesn't make a whole lot of sense to me. Financially, economically, I understand what the hospital systems are wanting to get to, but it just doesn't seem like the best practice for the people, right?
Sure.
For the future of surgery, the only trend that I can kind of see is just an increasing amount of specialization, and that might be true for medicine in general, just as medical technologies and treatments continue to evolve and our understandings of disease become more and more detailed. Mm-hmm. You go from a situation where all of medicine could be contained in one book that a doctor could learn to now there's 3 books for every subsection of disease. And so it really, requires more specialization for each disease. But
so your ability to see the ins and outs on a daily basis of what surgery looks like now, artificial intelligence is something that everybody thinks of as being thrown at their face right now, and information about that. Will that have an effect, do you feel like, in the medical field going forward as well?
Oh, I'm sure it is. I'm sure there are multiple people and companies working on how to integrate artificial intelligence into medicine. And I think that proper integration could really help alleviate a lot of the burden from healthcare in general, because a lot of the burnout doesn't come from caring for people. It comes from all of the documentation, the sifting through charts, the writing this, that, and the other. And so if someone can figure out a way to cut down those aspects, then they're going to be in business.
No doubt. One of the last things I want to ask you about is just about people that are wanting to go into the same field you're in. People that are aspiring to be surgeons and go into the medical field. What advice would you give them?
Make sure you're getting into it for the right reasons, because it's going to be a lot of time, a lot of work, a lot of effort. And if you are just thinking, hey, that's a good paying job. I'm going to go spend 13 extra years after high school training for that. You're not going to be happy.
Yeah.
But if you are the type of person that wants to dedicate your life and your time to taking care of people and learning everything you can to that end, then plan ahead, study hard, and just seek opportunities to help people, and you'll get there.
And then one of the last things I want to hear from you is just, I know you do a lot of different surgeries, but what are your emphasis when you're looking at surgeries? What different ones are you able to do?
So, like I mentioned, it's such a hard question, right?
Sure.
Because I've specifically put a lot of effort into having a broad skill set, but some of the more focused things that I enjoy and that I spend a lot of extra time preparing for are breast cancer treatment. That's a huge one for me. I put a lot of effort into working with breast-trained, fellowship-trained surgeons and plastic surgeons to be able to bring the best possible outcomes to women that are dealing with that and men, and really all aspects of breast surgeries. At our hospital, at Holton Community Hospital, we've invested quite a bit in having the best, mammography equipment, and since I've been here, also the best equipment for localizing and removing the tumors. And when it comes to most breast cancers that don't require, a plastic surgeon to reconstruct, that's all, we can take care of everything underneath this roof. I work closely with the medical oncologists, and they do most of their follow-up appointments here. People will have to travel for chemotherapy or radiation, if they even, require those. And just personal enjoyment, hernias, I guess,
Okay.
especially, large, challenging hernias.
Mm-hmm.
As much as I'm not sure I want to put that out there.
That's fine.
But I enjoy surgery in general, and I enjoy helping people. And now we're starting to offer vein treatments for the legs as well.
Okay.
So anybody who's struggling with varicose veins, leg swelling, come see us, get your veins ultrasounded, and if there's something that we can do to help, then I'm here for it. So another advantage of being out here is I have a lot more time than most to sit down and really talk through everything and explain surgical options. And if ultimately we decide that the surgery that's best for you is not something that we can do here, then I can connect patients with the right people.
What is the most common surgery that you perform?
Oh, I do just about everything here, man.
Okay.
Yeah, so the list is much shorter of things that I can't do here than what I can. Probably hernias.
Okay.
Yeah.
And there's nothing people can do to avoid that?
Not particularly. Unless it's, again, after surgery and just making sure you heal as well as possible to, potentially reduce your risk of an incisional hernia. But otherwise, most hernias that we're treating are ones you're born with in your belly button or your groin or something like that, or that come along with just older age and weakening muscles. So in terms of reducing the chances of developing a surgical problem, there's, I think not much that you could necessarily do, other than eat plenty of leafy vegetables. And that's not necessarily say go on a vegan diet. I think that the preponderance of evidence at this point is more that there's the value added there is more from eating more whole vegetables rather than necessarily eating less meat. So as long as you're doing that, the basic advice that your parents have always given you since growing up is really rings true. Like, try to eat more whole food that you can recognize. Try not to do too much of the processed stuff, and stay active, especially, as you're entering middle age and beyond. Stay active, maintain doing the things that you want to be able to do when you're older. Resistance training is important for bone strength, and and stay on top of your health. In terms of if you are preparing to have a surgery, to undergo a surgery, recognize that that's like asking your body to run a marathon. Your body's going to have to go through a lot metabolically and physically to recover and heal from that. So being in a more physically capable or more fit state prior to taking that hit from the surgery is going to leave you in a better place afterwards, and also making sure that you're getting enough protein in to rebuild tissues and heal up is also going to be important. My father always taught us to do it right the first time, right? And that's meant a lot of different things to me at different stages of my life. When I was little, right, that's tie the trash bag the right way so it's not going to dump out and you're not going to have to pick it all up, or do your chores right the first time so you don't have to redo them, wash the dishes properly. Later on, it becomes plan ahead properly and have a specific goal, a specific way you're going to get there, and then make sure you execute each of those steps along the way to do it right. But even in relationships with people, do the right thing the first time. You're not going to be able to recover from a damaged relationship the same way if you don't do it right the first time. Well, and it's key in surgery too.
Yeah, exactly.
You can't always be 100% sure of what exactly you're going into, but you get as close to that as you can, and then you have a plan, you execute it to the best of your ability. Yeah. Especially if it's going to be a particularly challenging one, because there's a lot of planning that can go into, and contingency planning and plan A, B, C, D, E, I do the exact same thing. The night before, the morning of, both or all of the above, and I'll imagine through the entire thing.
I'm Dr. Denis Jimenez with Holton Community Hospital General Surgery.